So, fertility issues are always a woman's problem.
Not at all, not at all. Please, biggest myth. Estrogen is the happy hormone, is going to make you look beautiful.
I had some important question when you were talking, and then I didn't want to cut your flow. Now I forgot that important question. Oh, yes. I was thinking, wow, my gynecologist is so good. My scar is not even seen.
We like to take that credit.
Welcome to Skin Science. I'm Dr. Rashmi Shetty. On Skin Science, we dive deep into the world of beauty to uncover the science beneath the surface. We'll explore connections between beauty and everything associated to it with insights from experts from the medical, wellness, and beauty fields. Join us as we go beyond the basics and reveal the true skin science. Gynecology is such an integral part with dermatology. I almost talk to a gynecologist literally every day in my practice. There is either an acne, there is a PCOS, or there is a premenstrual syndrome. There is some sort of oral contraceptive people take where I want to know, should I not cut it down for my sake, for skin? So there is some discussion happening with a gynecologist. So I thought, let me get the new kid on the block, very interesting and yet an expert, gynecologist Dr. Tanushree Pandey. She's the founder and director of Samadhan Hospital and Hope Fertility Center in Mumbai. She's been awarded the Youth Icon of the Year in Fertility for the year 2023 and is forever striving hard for couples to achieve their dream of having a baby. Hi, Tanushree.
Hi, Dr. Rashmi. Thank you so much for having me over. It's such a delight.
Thank you so much. Let's today talk a little more in depth about every little phase of a woman's life,
Absolutely.
which causes so much hormone imbalance, and not just imbalance, upheavals, I would say would be a more appropriate word.
Right.
And just kicks off your mind, body, and everything with it, right?
Absolutely.
So, starting from the very beginning, menstruation. Why do you think we are seeing girls menstruating or getting their menarche so early these days?
Right. That's such an important and frequently asked question, I think, from all of us, because earlier we would talk about menarche at around 11, 12, sometimes as late as
Much
13
later,
or 14.
right? Yeah.
And now it's 9, 10.
My God.
And the little children don't know how to use a sanitary napkin. They don't know what is happening to them.
Yeah.
What is this blood? Where is it coming from? And of course, a very commonly used thing that we talk about, which is really important, which is changing a lot of hormones in our body, normally said as stress,
Yeah.
but which plays such a quintessential role in our hormones, in our cycles. And if we go in detail in the estrogen and progesterone. And as we know that estrogen plays a very, very important role in achieving the puberty or the starting of the menstrual cycle.
Correct.
And because estrogen is literally everywhere in everything that we're eating. There is such a huge thing about all these plastic things that are being used in microwaves, which, later on affect the estrogen in our body.
Wow.
The food that we are consuming, which is leading to a higher BMI. The BMI, which is increasing, it is making the peripheral fat convert into estrogen again increasing the levels of estrogen. And therefore, also the overall environment and the maturity of a young adult reaching faster. All these things put together are leading to menarche happening earlier. There's nothing to be scared about. We just have to be prepared. We just have to be educated, and we have to empower the young adults that they're going to get their periods sooner.
Does by any chance early menarche mean early menopause?
Now, see, we don't have such a huge case study and data, to be honest. Yes. In general terms, an early menarche will lead to an early menopause because we are all born with only a certain number of eggs. So it's not like,
Did you know that? That's such a fun fact or an important fact that we are just born with a certain number of eggs.
Exactly.
We just release them periodically, and the day it is over, you're done.
That's it, right?
Yeah.
So, I mean, and that's why so many people are coming in with something known as a premature ovarian failure, where in young 20s and 25, 30, their anti-Mullerian hormone, which
It's so
tells
low.
us the quality and the quantity of the egg, becomes extremely low, and we're left with like 4 follicles, 5 follicles at a young age of 25. So, yes, girls are stopping periods early, 37, 38. The new menopause has become 41, 42.
Yeah.
So, yes, that is happening. Now, we will also have to be a little more vigilant if it doesn't happen, because an early menarche and a late menopause exposes us to certain hormones, which we then have to be more careful about the endometrial lining and so on and so forth. So, yes, we'll obviously have to keep the visits to the gynac annually and not take it so lightly any longer. But nothing to be afraid of. It's just a change, it's evolution, and we have to embrace it.
Lovely. So, what I have seen along with early menarche, like we were talking, is obviously early skin changes.
Absolutely.
So, very young little girls come with, oh my God, I have acne on my forehead, and oh my God, my hair growth has already started, my underarm has hair, and my hair on the body is a little more. So, the question that I get asked is it okay to do something to treat your acne at such a early age? And I keep saying, yes, it's okay, because you would rather treat that acne than leave the scars behind, which is so much more difficult for us to treat. So we may start with something as simple as certain application to reduce the effect of the excess sebum secretion, which is very hormonally induced and which is pretty normal. Or maybe simply the same sebum secretion in the scalp leads to a very, very seborrheic scalp, then leads to acneiform eruptions or acne on the forehead that we end up treating. And even this age of starting laser hair reduction, we have accepted can be earlier. So we start as soon as around 13, 14 years. We end up starting 16 would be a good year if you can wait. But some people, when you have that excess hair because of early menarche, it is absolutely okay and safe for you to start your procedure such as hair reduction laser. Now, the next thing I want to say is, like you said, they're so young and they don't know anything about it. Can you simply explain to them what is a menstrual cycle?
Right. That's, I think, a very beautiful question that you've asked, because I think there's so little education in schools, unfortunately, unless and until you reach your junior
Biology class,
college.
yeah.
And yes, and then, you
Yeah.
take up this stream,
Yeah.
you really, even I didn't know what menstruation or menstrual cycle is. So, like you emphasized on and correctly said, that it's a cycle. So, the cycle begins from the first day, which is the day you start seeing blood, which in a common term, you'll say it's my period or I'm on my menstrual phase. And that is the menstrual phase or the bleeding phase, wherein the period happens, the blood flow happens. And then starts the follicular phase, which is the estrogen dominant phase.
Correct.
And I always tell all my lovely patients and girls that when we feel certain emotions during the cycle, it's very scientific,
Yeah.
because estrogen is the happy hormone, is going to make you look beautiful and is going to make you
Glowing
feel
hormone.
yes, young and confident. And it's during that phase when you feel energetic, you want to do 100 things. And then comes the follicular phase, slowly will lead to ovulation, which is very important, not just for people who are trying to conceive, but even for people who want to have a normal cycle. It's this which gets impacted in PCOS, which will eventually lead to a constant rise in hormones and will lead to things like acne, hirsutism, irregular periods. So ovulation is extremely important, and that will happen around the 14th to the 18th day. If during that ovulation there is no unprotected intercourse, there is no baby that is formed in the womb, then we lead to the luteal phase, which is the progesterone dominant phase. Here is where you're going to feel gloomy, you're going to have your PMS symptoms, you'll feel bloated, you won't feel like doing too many things, and it's okay. That's what I try to tell all my patients, that it is scientific. So if 5 days before your periods or 7 days before your periods, you're low on energy and you don't feel like going to the gym, or you're trying to push yourself, all of us are doing it. It is hormonal and it is extremely medical and scientific.
Yes.
And then that is when eventually the luteal phase ends. And if everything's normal, your progesterone, estrogen, all of that then come to a low, and then your period flow starts. So it's, if you see the graph, it's really beautiful, and there are ups and downs, and that's how our moods feel, that's how our skin feels, and that's how we overall feel as women with menstrual flow.
Exactly. So this is why also the skin alters from a great looking skin after your period. But sometimes for some people, what happens is, because you've lost so much iron, you've lost so much blood during that period, the first couple of days could be days of recuperating. But if you're already anemic and if you have lost more blood, you may even end up starting to lose a lot of hair in that period, which is important. So, a cyclical iron therapy may also end up doing a lot good, or simply over the period taking a supplement which has some iron in it, a low dose iron in it, may also help. Other than that, the estrogen is brimming, so you look most feminine, most beautiful, feel beautiful. So, all of this happens, and that adds to how the skin really looks. Then you have the second part of the face, which is just before your menstruation. Some people do have one or two acne that just comes during the ovulation that she was saying, when the egg release is there. So that can just happen at that point of time. But most people have it premenstrually because that's the time the progesterone is at its peak. What happens? I also want to ask you for you to explain to the patients, does prolactin play a part at all in the menstrual cycle? Or is it just a part when there is lactation and at that period of time?
So yes, very good question again. So many times when patients will come to me and they'll be like, we have irregular periods, and unfortunately or fortunately, they've self-diagnosed themselves that it's PCOS or it's PCOD because that's what the internet has told them, and they don't even know that there's a hormone in our body that is known as prolactin. So something, it's very funny, but when we write a prescription and we write the thyroid profile and then we mention prolactin, and they're like, but we don't want to get this blood test done, we've never heard of this, Google doesn't tell us about this. Also, there are patients who will come really petrified, young girls, when their prolactin is raised. They'll be like, but doctor, we are not pregnant. We did not have unprotected intercourse. And to explain to them that this is not this, in normal situations, it's a hormone that will rise up during lactation, but then it's a hormone which rises up in our bodies, which indirectly or directly will lead to irregular periods. In fact, it has a very close association with your thyroid gland. So many of us who are suffering from hypothyroidism will lead to hyperprolactinemia, meaning your prolactin is going to be more. The moment prolactin is more in your body, your period is going to be delayed. When your period is delayed, you're going to get a lot of acne bouts. You're going to get, your period is not going to come. You're going to feel bloated. Your skin is going to feel puffy, and all the sprouts and sprouts of acne are going to come. And that's the reason why not only does your PCOS, if at all you have it, needs to be controlled, but also your prolactin needs to be cut down and your thyroid needs to be controlled for a full holistic well-being.
That's exactly why I got the question at this point, because it's not just the progesterone which can make you look red, angry, and have acne on your face. It's a very important hormone called prolactin that does a very similar action to the skin. Makes it angry, makes it red, makes it puffy, and you have acne, which is actually painful, red, and inflamed. So that is led by prolactin, which, like Dr. rightly said, is usually associated also with the thyroid, with the period imbalance, and probably also excessive hair fall. All of this could be done together. So that is the pre-period phase. And then if you're in a normal cycle, you bleed and all the hormones plummet. You can feel a little blue. But this is how a skin cycle and a hormonal cycle in terms of menstruation correlate with each other. And you can predict literally one from the other. Isn't that very interesting? Now, the next thing that I wanted to ask you is that, please tell us a little bit of various forms of holding your blood back, or rather period pads. So there is pads. I see a lot of young adults come to us with rashes at that times around their thighs, literally cuts. Sometimes they come with inner thigh cuts. Then eventually when these rashes become repetitive and always keeps happening, they end up coming up with dark inner thighs, which they so detest as they are growing up. So please tell us, is there any newer pads which are more friendly, or is there newer other methods? Are people who have never had an intercourse, can they use a tampon? That's a question that I keep getting asked. And what are the other methods?
All right. So I'll just give like a this
Prelude
thing
to
to
it,
it.
yeah.
Yes. Is that firstly the mamas who are watching this, because the
Yeah.
younger girls are going to be very open to everything that I'm going to say, but then they're going to be
That question was for the mama.
Yes, that they're not going to be very
Yeah.
comfortable with when I'm going to suggest the other options. Two things that I want to first talk about is, like you said, the tampon or the menstrual cup is not going to break the hymen. It's going to do nothing to it. Even if it does, because hymen is not something that you can break. It's like an elastic thing. It's like a curtain which can sort of go on the side, and or it can just stay there. And it has nothing to do with the virginity. So there is no concept as virginity, because there are going to be 80% of girls of today who are extremely active physically. They are playing sport, they're swimming, they're horse riding, they
Broken
just have
anyways.
yes, and there is no hymen and there's going to be no bleeding, and the so-called virginity with the first intercourse is not going to be gone or broken. So instead, we all have to come to something known as a hygienic way of dealing with
Yes.
your menstruation, and it could be anything under the cloud of, we have today the standard sanitary napkins that we have, then they have come into the good biodegradable ones.
Oh.
Because we all want to talk about the environment now,
Correct.
because we do realize that one pad takes more than 100 years to actually degrade if left naturally.
Really?
Yes, so that's why then it's the biodegradable ones. Understandable, but that they're more expensive. Not everybody can buy a packet which is 4 times more than the standard packet. So that's where something very
And they are
nice.
available
They're
in
available.
India
They're available
easily?
very easily.
Mm.
They'll be available on Amazon and Swiggy also. It's that easily
Okay.
available.
Huh.
But one thing that is extremely economical, environmental friendly, very easy to use, I'm a strong advocate of it, is a menstrual cup.
Ah.
A menstrual cup is something which is like a tampon, but it can be reused and reused and reused for up to 10 to 12 years.
It's hygienic?
And so it's so clean because it's made up of all those materials which are safe to be inserted. They are either silicone or they're made of some kind of rubber which is extremely safe. It's not going to cause any health hazard or allergy to your body. It comes with a little bag. You just have to take it out, empty the menstrual blood in whichever toilet that you're using, wash it with normal soap and water, reuse it. When your entire cycle is over, you just have to boil it and keep it in a clean place. If you have an extreme OCD about, I want to keep it absolutely zero germs, there are beautiful sterilizers that come with it once you finish with your cycle. So basically, you finish with your 5 days of period, just once you have to boil it or sterilize it, put it in a corner, reuse it again. So you're doing your little bit for the environment.
Wow.
It's extremely comfortable to use because just how you said about the rashes, there are patients who will get rashes. They're ones who are going to be like, but we have a trip coming up and we want to go swimming or we want to do all sort of adventure sports. With a tampon, it's great, but you have to understand, it's going to swell up a little underwater. So you can't really swim for too long. With a cup, you're free for 6 to 8 hours. It's safe to keep the cup in for 12 hours. However, in your first day or second day of flow, when it's more, you'll want to just, take it out in the 6th or the 7th hour. Initially, when you're trying to use it, you can use a panty liner with it, or there are lovely period panties that are coming these days. So what we have to understand is, even when I started menstruating, most of these options weren't there. And that's why when I initially started advocating them, I had to start using them. And there was such a mental block. I can't do it. Is it going to get lost? Or not for me, but that's what the patients ask. And then when I started using it, there were times when even I was stuck with the cup because it creates a vacuum. And that's when you just have to relax and be like, it's not getting lost anywhere and it's going to come out.
Oh,
But
interesting. We never
worth
had
giving it a
this.
try. Yes.
Wow.
Yes.
Also, I want to ask you, a lot of patients of mine are on oral contraceptive.
Yes.
Either they're there because they're sexually active,
Mhm.
or they're there because there is somebody who's given it to them for their PCOD or some menstrual irregularity. And they come to me panicking and they say, Doc, but my bleeding has completely stopped. And I keep telling them it's okay. It's an annual-ovulatory cycle. That's how this works. And if your uterus is not getting prepped for an egg that's coming out, body's intelligent. It kind of knows it's not prepping it. And therefore, you don't have too much lining to shed. And there is no blood there.
Correct.
But I want to ask you 2 questions here. You, from a gynecologist perspective, please explain the same thing.
Mhm.
2, they're also scared now that they're not bleeding,
Mhm.
what's happening to their fertility.
Correct.
So please explain that to us.
Right. So first things first, the oral contraceptive pill or the birth control pill or the 21-day pill, however you all know it, I don't know why everybody thinks it's a huge thing to take it or it's your enemy and there's
Yeah.
so much around. Hormones are in your body. Everybody has hormones. The thyroid is a hormone, the estrogen is a hormone, the progesterone is a hormone. And yes, the birth control pill has the hormones. It has hormones to plateau the hormones. Because whether it's your PCOS, whether it's your raised prolactin, or any spectrum which is causing the acne or the PCOS or the irregular periods, is because there's a fluctuation or a massive rise in those hormones. And that's why we want to bring it to a plateau. We want to bring it to a stage where your body can handle it. And that is what these pills do. And like you rightly said, that why is there less bleeding is because when the ovum, the egg is getting formed, simultaneously the endometrium is getting thickened. We get a trilaminar or a thickened endometrium. That is what sheds in an ovulatory cycle or a normal menstrual cycle. However, in the pill cycle, we have repressed the ovulation, which leads to a thin endometrium only and only for that cycle. Whenever you stop it, and yes, I'm not going to say a blanket statement, because if you overdo it, if you don't stop it when you're supposed to stop it, if you self medicate, if it's too long and not stopped at the right time, for a temporary period of 3 to 6 months, you might face a thinner endometrium, which will come back as soon as your hormones come back. But if you're somebody who is in your fertile phase and at the same time you've been given pills to control your PCOS, because just not in acne but also PCOS uh, takes care of the egg quality. So it impacts the egg quality really badly. So even when you have too many eggs, excessive eggs, they're all going to be hyper mature, which are going to be old. They're not going to result in healthy babies. That's when the missed abortions come in. You get pregnant and then the heartbeat of the baby doesn't come in. So sometimes we give 3 months of these pills to suppress all those extra eggs. All the cysts. What is PCOS? Those are those cysts, the eggs that did not rupture are the ones that form cysts, polycystic ovarian syndrome. So it's absolutely normal to take these pills. In fact, as a fertility expert, I can tell you we give birth control pills sometimes for the first 3 months as the AMH is really, really high. We want to get it low. We want to make sure that the quality of the oocytes improve and then eventually take them to pregnancy.
So interesting. This is something which I think will take away a lot of myth.
Yes.
What is the ideal number of days to bleed? Is there an ideal number of days to bleed during menstruation? And what is it?
Right. So some people will come to me, oh, I bleed just for 2 days. And the others will come, oh, I bleed for 8 days. Both are normal. Anything between 2 to 8 days is normal, provided this cycle you bled for 2 days and then the next one you bled for 8 days. That's not normal. So it has to be consistent. Like we say, even a cycle, a period cycle, anywhere between 22 to 38 days, these days is considered normal. However, it shouldn't be that this month I got my period in 22 days, the next time I got it at 38 days. A few days here and there is okay. Just like that, if you're bleeding heavily on the first and the second day, spotting on the third, fourth, fifth, or sometimes the sixth, seventh, that is normal. Just 2 days of bleeding is normal. However, if you're somebody who is bleeding, say you were changing 4 pads for the first 4 days and suddenly it's come down to 1 pad for a day, that's not normal. So if there's a sudden fluctuation, whatever is normal to you is going to be normal most of the times. Now, of course, if you're not getting your period for 3 months, that's not normal, but a 38, 42-day window. However, any fluctuation there, and there's a problem and you must see your expert.
That's exactly why in my consultation, I ask you all, is your period regular? That's it. So whether it is a 28 day, 38 day, I don't care. Is it regular is what I want to know, which is what should be which gives me an idea that your hormones are releasing in the right order. And that may or may not be the cause of your, let's say, acne that I'm looking at. And I will start digging into other things that I want to find out further. The other times where I have seen where the skin really tosses up and plays up is this morning after pill. Oh my God, I just hate them. And I keep asking my patients, in the last 6 months, did you take it? Or in the last 3 months, did you take it? And I can bang on, tell people from the skin who have taken it and they'll say, yes, how did you know? Because they just cause havoc. Will you please tell us what exactly is a morning after pill? And how is it so powerful that it can stop pregnancy?
Right. So I'll give the example that I give all my patients. So I just say if I'm having 1 cup of coffee every day, it's not going to do any harm to me. In fact, it's going to keep me a little agile, awake, and if I need it for my work, I need it for my work. However, if one day I decide to sit with 70 cups of coffee and have it all together, definitely there's going to be something wrong with my body. There is no way.
So I want to stop here and want to ask you, why did you say 1 cup against 70 and not 1 cup against 7? Please reiterate it to
Right.
everyone.
So that is the amount of extra progesterone that is in one single pill that you take. So every day when we are giving you these chotu 21-day pills, which have absolutely micrograms of the dosage of estrogen and progesterone, is going to do nothing but going to control your hormones and manage everything that we are trying to manage. However, when you go and you pull in that 75 milligram altogether, and sometimes they're going to take it twice or thrice because they've gone on a holiday and they're like, oh, we did unprotected sex multiple times, so we took one pill today, then 2 days later, and then 4 days later.
Okay, please tell me. So if they have 3 days unprotected sex,
Right.
and if they decide that they want to have it on the last day,
Right.
will it protect them from having the baby from the first day's intercourse?
Okay, so now firstly, any of these emergency contraceptive pills have an extremely high failure rate. So even if you've just finished doing your business, gone to the chemist, popped it in, there are still 25% chances that you might still really, come back with a pregnancy or retain products of conception or a massive hormonal imbalance leading to excessive bleeding. You've bled for 1.5 months, you don't know what is happening. So whether you've taken it 4 hours later or up to 72 hours, the failure rate is there, which is as high as 18 to 20%, will go on increasing as time passes. Yes. So if at all now, if it's happened and there's nothing else that you can do, then sooner the better. But then the next morning also, if you ended up doing the same thing again, you don't need to take another pill.
72 hours, you're covered, you're saying.
So
Okay.
and that cycle is as it is
Yeah,
haywire now.
yeah,
Your hormones
yeah.
are gone for a toss with one pill. So
Exactly.
in that cycle, you don't need to keep repumping it like chana mumfli,
Yeah, and that one big 70
Yeah.
ounce of damage that you have done,
Correct.
for me as a dermatologist, takes me 3 to 4 months to flush it out of the system to get your skin all right. The end organ really gets affected the worst. When I say end organ, I'm talking about skin and hair here, gets affected the worst in it. So guys, it is safer to have protected sex. It is safer if you're having frequent sex, and if you have a sexual partner, then it is better for you to take a daily dose of 21-day oral contraceptive. Much more safer for you and much more effective for the cause that you're taking it, as against a morning after pill, which is literally trying to kill a sparrow with a, one of my surgery professors used to say, this is in Kannada, gubbachige brahmastra, which means to say for a sparrow you're using brahmastra just because you had it. So sometimes it may not even kill that gubbachi and spoil you. So please make sure you don't do this, and it's a wise way to talk to your gynecologist and figure out what you do if you do have situations such as this. What are the other types of contraceptives that you may say young adults can use? I'm dwelling on this question more because it is this which brings back to me the aftermath of it. So I want to go a little more deeper so that the young adults watching this can really educate themselves as to what could be safer options if they are not on a daily pill.
Especially for the young adults or anybody who is still figuring out life, has decided to have their
Sorry
choice.
about that question.
Yeah,
No young adults.
yeah, right. So, and anybody who has multiple partners or even one, but is not sure as to, because I'm coming to the part where you have to use a barrier contraceptive. So even if you are using a birth control pill, I am a strong advocate of barrier contraception, because of course, as a skin expert, you're going to agree that there are so many sexually transmitted infections that are going to come in, even if you're on a birth control pill or something known as an intrauterine device, which is a copper T. Having said that, if the condom has a very high failure rate, so why do we always talk about dual contraception? Why do we talk about condom? Is because we want to protect you from STIs also. But why do we say take another method of contraception? Because condoms have an extremely high failure rate. Also, sometimes you or your partner just not in a mood to use it, and then what? You're suddenly stuck without contraception. So for that, like we've already covered, birth control pills or hormonal pills that are there. There are also implants, patches, and something which is non-hormonal, which is very safe, is an intrauterine device or a copper T. It comes in two forms, a hormonal one and a non-hormonal one. The non-hormonal one is extremely safe. You can put it for 2 years, 3 years, 5 years, up to 10 years.
Even before you've had a first child?
Yes. So this is something that we have inculcated now. It's changed in the last, say, decade probably. Earlier, we did not have clear guidelines. However, now, if you're sexually active, above the age of 18, and you're ready to give your consent, we can legally put an intrauterine device for you.
And that has no impact on fertility or tomorrow any sort of uterine wall damage.
Right. So fertility, no, unless and until is done in a sterile, hygienic way, because we don't want anything leading to infection in the uterus or endometritis. If that doesn't happen, we are good there. Whether it is the right option for you or not, we always say that contraceptives it's a cafeteria approach. So you sit with your doctor and you discuss what is best for you. And then, because hormones are not going to suit all, somebody is going to have excessive bleeding after getting the copper T put. But till the time you don't reach there, till the time you don't try it, you don't know. So instead of just feeling extremely, handicapped and not knowing what to do, You have to try. There are a lot of things. Luckily, today we are there. Yes, contraception is forever evolving, and we still need newer things. We need things where men have to go through it and not women. But we've come a long way, and there are a lot of options. So you have to sit across with your gynac, discuss it, and according to your age, medical conditions, your need, we are going to give you the best option.
Also, no impact on fertility from a morning after pill.
Now, morning after pill is going to have an impact, of course, because
Yeah.
it's going to put your ovulation to toss. So then it's going to take, you are going to agree with me that it's going to take us 3-4 months minimum for your cycle
Exactly.
to come back to normal.
Yeah.
They'll come and they'll tell me, when am I going to get my next period? I'm like, now you
Wait
wait.
and watch.
Your
Yeah.
guess is as
Yeah.
good as mine.
Yeah. Yeah.
Because, we don't know which part of your cycle. So earlier on, we spoke about the cycle and we don't know where that progesterone has made your cycle reach. So now we'll have to just wait for your period to come or your withdrawal bleed to come.
So true. So be more careful. Now, let me talk about a few things that happens during periods. For example, a lot of patients come and talk to me about bloating before periods. Why does it happen? And how does one prevent it?
Right. So bloating in medical term is water retention. And why does water retention happen? Because of the hormonal change. So progesterone in your body will lead to retention of water in the third space. So it's not like it's suddenly coming from somewhere or you've put on weight. It is already there. It just starts showing in the superficial area, which we commonly refer to as the third space, which will lead to your eyes looking a little puffy, your face looking chubbier, your tummy looking bloated, and it's okay. You have to cut yourself some slack. You cannot, look at yourself in the mirror and be like, oh my God, I'm looking like this today, I'm looking like that. It's absolutely normal. All of us, no, all of us, that I can tell you with absolute this thing, even models will have these days, and they'll actually put their shoots in a way that, when they're just before the period, they're not really doing a shoot wherein they have to look absolutely skinny, or there's a lot of Photoshop and there's a whole lot of things wherein the woman is going to look perfect. But for the people watching this, it's absolutely normal. If you're just before your period, on your period, right after, there are going to be changes, and that's fine.
Yeah, so that's when people come to a dermatologist setup to understand what needs to be done to these situations. Like Dr. rightly said, that when it comes to third space, the accumulation is more shown on looser areolar areas, such as your under eye, where the skin under the eye is not necessarily stuck to something underneath it. There is a loose areolar tissue, we call it, which is fat tissue there. And the water getting drawn there and accumulated there and bloating showing up there is more easy for the body. So therefore, it ends up showing as a massive or an exaggerated under eye bag. Sometimes even the bag above your eye can get more. So the eye starts to look not so bright and happy and like healthy because there's water all around the eye. The tissue here is very, very loose. So it accumulates and shows more water. It ends up showing more water on the face also for some people, and say my face looks bigger during periods. That's only because there is so much water that is drawn into that area. Few easy things that you can do is simply move your face. Like they say, calf is a peripheral heart, right? So if you do have lower leg water retention, you either raise the leg or you work your calf muscles, it'll pump it all back. Likewise, when it happens on the face, all you have to do is really close your eyes tight, open your eyes. That just helps drain out that lymphatic fluid, drain out that extravasated fluid in the third space, making your skin look maybe for a bit better till it again fills up. Because if it's that period, right, it's not just a one day thing. So it may fill up, but for that little photo shoot, for that little thing, it just kind of starts to look a little better. A lot of people also ask me, can we use those face tools in those times? So face tools are not going to give you one permanent long-term result. They are not going to give you a face lift. But what it actually helps in these situations, you end up using either a, what do you call it, a jade roller.
Yeah, or the gua shas.
The gua sha. I was wondering what is that thing. Now you're good. So the gua sha. So any of these things, they think that will give you a sharp jawline is not going to happen. All it does is take away the fluid from that third space,
Right.
to just make your skin for that maybe next half an hour, 1 hour till the fluid fills back, feel a little more tighter, contained, less bloated. That is what it does. Simply doing neck rotation, neck exercises, which also helps you clear up stagnation of fluid there. So these are a few things that we end up talking to them when we say the pre-period bloating.
Right, right.
The other thing that I also want to ask you is fever.
Mm-hmm. Mm-hmm.
Is it normal, right, to have fever or a little bit of raise of temperature?
Right.
before period.
Fever is, when we talk about fever, it has to be more than 100 degrees Fahrenheit for to label it as fever.
Yeah.
But yes, a raise in the basal body temperature. So you are going to feel warmer. Your friend is going to come close to you and be like, "Are you're feeling warm today?" And don't worry about it. Don't panic. That's normal because it's just before your period, and even sometimes when you're going to ovulate, your basal body temperature rises slightly, very, very slightly. But that is enough for somebody who knows what, whether it's your mom or your partner or your brother, to know that, oh, how you feel normally. And they're going to come in, and or you're going to feel a little hot. That's also because of hormonal fluctuations that are happening. So that's
That's the
normal.
way earlier they used to also time,
Yes.
when
Yes, back in the day, of
back in
course,
the day
when,
when there was
when we
not
didn't know how else
so
to.
many investigations, they used to just
Absolutely.
say that body temperature was what measuring your ovulatory cycle,
Yes,
and when
yes.
you're releasing your egg,
Absolutely.
so
Absolutely.
called the most fertile period
Period.
in
Yes,
your.
yes. Absolutely.
Also, how much is all this related or associated with the gut? Because a lot of patients also come with intolerances of food, or literally gut abnormalities or gut disturbances during periods, right?
Yes.
How does that scientifically connect?
It connects a lot. So I am somebody who is really, especially with young adults who come in with PCOS, they have to watch their gut because they have no understanding. Okay, I'm not saying that just go with fads that everybody has to stop gluten or everybody is going to be lactose intolerant. No, but you will realize if there are hormonal fluctuations, you are going to be more prone to some things that are not suiting you. In my case, I had the worst acne. I still deal with adult acne sometimes, and I realize the moment I have lactose, it relates. So I know for me, it causes problems, and it doesn't suit my skin, it doesn't suit my period, it doesn't suit my overall. I feel bloated the moment I will consume lactose. Now, if I go to a doctor, one of the specialists, they're going to be like, no, but you're not particularly having loose motions. And so maybe you're not intolerant. But I know it's not doing good to my gut. So it's extremely important. Don't follow fads and don't go blindly that just because, somebody or some film star has said that they've gone gluten free, even I have to go gluten free. But if it is not suiting you, which maybe when you're at a younger age, you're not going to be that aware. So if there's somebody, an expert you're going to is guiding you through it, be a little more open-minded, experiment, try to omit certain things, see how your body is reacting. And your body is your best guide, especially when it comes to food. It's going to tell you what's suiting you and what's not suiting you, and listen to it and follow your gut then.
I didn't tell her all this, okay? Because can you see exactly what I say is what she's talking? So, therefore, the experts that I chose were people who are very like minded in this whole thing. And recently, you know what? I got a 1 star on Google. And they said, you better learn your modern sciences well. Everything is not related to gut and body weight, was the comment. And I got a 1 star for telling a young lady with PCOS to watch her gut and her weight before I put her on 10 skin treatments. So, guys, you must understand, as much as we are advancing in science, we are coming back to understand how much basics are important. And if you see, whether it was an endocrinologist, whether it was an Ayurveda specialist that we spoke to, or whether it is a gynecologist I'm speaking to, or the other day we spoke to yoga expert, everybody from every specialty, including me, the dermatologist, have been talking to you about how important lifestyle is. And one of the most important things in lifestyle is your gut style, I can call it. Food is more important. That is your foundation. And then, of course, is your what weight. It's such a scary place to say weight. Oh, you're body shaming me. It's not. How do I politely tell a person that weight is such an important thing for your hormones?
Absolutely. So, I think everybody who's watching us, firstly, at least for us, we can confidently say we are not here to judge you. If weight had no impact on your health, we would have not spoken about it. However, you name one organ, any organ, and weight has an impact on it. Whether it's your skin, whether it's your heart, whether it's your uterus, whether it's your kidney, whether it's your liver, any organ, whether it's your hair, whatever you can think of. And I understand that if the problem is this generation, especially when we were kids, our parents were not that aware and we were not told having 4 tablespoons of sugar is not good, or having a burger is not good. And that's why today corrective measures are difficult, because maybe the generation that's going to come in next is going to have more mindful parents who've already started substituting food that is not healthy for healthy substitutes right from the beginning. So the child is never going to crave for it. But say for me, if my mom used to say, give me a packet of chips every time, I was throwing a tantrum, even today when I cry, I want that packet of chips. So we understand why the weight has come in. However, we don't have the fortune of only being the good cop. We have to play good cop and bad cop for your benefit. So we always talk about baby steps. Whenever they come to me, I tell them, if you lose 5% weight, I assure you, you're going to get your next period with much lesser medication. Just 5%, which is for some people is going to be 2 kgs, 3 kgs. You know what I mean? And it's going to slowly. So baby steps. There are some patients who'll come in and they'll be like, don't talk about my weight.
Yeah.
You give me the solution to how do I get my PCOS normal without medicines. So
What do you do? Magic wonder?
so I always tell them, number one, I'm going to give you medicines. That's because I don't want to leave you alone. Right now, if I'm struggling with my mental health today, and you just tell me, oh, go and feel better. I'm not going to. I'm going to need certain therapy. I'm going to need certain medication if needed. So I'm going to give that to you. I'm going to give you the help, but you have to start taking baby steps. So if you've been of a higher BMI all your life, we have to start walking. I know it's tough. Everybody has some or the other struggle. Sometimes they look at me and they're like, oh, just because you don't have a weight problem, you can come in. I'm like, you don't know my story. So I suffered from lean PCOS for the longest time. So even though weight wasn't a thing, I know the moment I stop working out, my periods go for a toss, I start getting acne. So every morning that I sit in my OPD, my patients like, we saw your Instagram story, you were working out. How do you get the time? I'm like, for me,
Make the time.
For me, it's a necessity. I have extremely bad genetics when it comes to the heart. My mom had heart issues. My dad had heart issues. I know I have to deal with it. Now, either I sit down and I'm like, Abhi to, this is how life has been, is going to be, or we make changes and not for anybody else. You're going to change the doctor if you don't like us and you're okay with it.
Yeah.
But you can't change yourself. You're going to be accountable to yourself. And the weight loss that we talk about, it's for them. What are we going to benefit from? So many times, like you rightly said, we are going to lose that patient.
Star.
Exactly.
I just get 1 star.
Exactly.
But it is what it is. Like I said, it's easy for me to give you a string of skincare treatments. Iska package, uska package, like mostly happens.
Exactly.
You're so tuned into thinking that is the right way, that when a doctor says, first let us lose some weight, first let us get this in order, your skin will become healthy. You're like, oh, is it so? Does she really know her subject well? So
judgmental. She's judging me.
She's judging me. She's body shaming me. How could she talk like this? All this ends up coming.
Yeah.
But sometimes it's just fixing the basic, which does everything.
Right.
The other thing that I wanted to ask you, I had some important question when you were talking, and then I didn't want to cut your flow. Now I forgot that important question. Oh yes, I got it.
Mm-hmm.
So what about during my pregnancy with Upu,
Mm-hmm.
I used to, in my whole life, I haven't eaten chips.
Okay.
After that, I haven't eaten.
Okay.
I am a very healthy eating person.
Mm-hmm. Mm-hmm.
I had to have Lace Ruffles Magic Masala and
wow.
Pepsi going together.
Right.
And I as a doctor know I shouldn't have had aerated drinks.
Right.
I could not stop my craving.
Right.
Now, I want you to please tell me, how, one, do you control the craving? Or should you just give in and indulge and then say, let's see later?
Right.
How a wrong craving can actually affect the fetus.
Right.
Two, I'm also asking this for all the young guys there thinking, it's good to become healthy or put on weight during pregnancy. I will lose it later. That's not going to be happening so easily, guys. So please, from the horse's mouth.
Right. So few things, the older age used to say that you have to eat for 2 when you're pregnant. That's absolutely wrong. Depending on your BMI, we are going to tell you how much weight do you need to put on. In very rare circumstances, sometimes we don't want any weight to be gained during pregnancy, because weight gain during pregnancy, if not recommended, is going to make the pregnancy complicated. It's going to lead to miscarriages, raised blood pressure, diabetes, thyroid issues. So yes, cravings are a part of pregnancy. They're also beautiful, and they're going to, it's absolutely fine to embrace certain cravings. However, if it's getting beyond your control, if the doctor has categorically told you that, look, the water around the baby is too much, stay away from sugars, you're not being able to handle it. It's probably your body again telling you there's some kind of insulin imbalance that's happening. There's some kind of hormonal issue that's happening, and that's why the cravings are happening. Because so many times our PCOS patients come
So
to us.
craving is not normal, you're saying?
So cravings are normal, but
Huh.
excessive cravings are not normal. Like if 2 in the morning every day you're waking up and you have to have that chocolate pastry, then there is. But once
They
in a while,
romanticize it, then saying,
Yeah.
"Oh, I asked my husband for mera wala ice cream, and he
Yeah.
went to two and brought it."
right, and once in a while that's okay. That's I mean,
Yeah.
and that pregnancy is going to happen. It's going to happen. The hormones are absolutely going through the roof. There's nothing that you can do about it. And as long as you've done your half an hour walk, you're doing your regular gynac visits, normal controlled cravings are fine, given, enjoy your pregnancy. But if it's getting out of hand, then of course, show it to your gynac. Don't put on too much weight, which you cannot lose no matter what your mama, your mother-in-law, Masi ji, Baju wali auntie is saying, because it's going to be extremely difficult. And then when you don't lose that weight 6 months later, that auntie is only going to come and tell you, "Arey beta, bade healthy ho gaye ho."
Exactly. Yeah. But you know what? I also remember that I started working out literally, I think 1 month after my pregnancy, isn't it? And then I had a C-section. But I remember I keep telling my daughter Upasana that on the 16th day we have this cradle ceremony. I could get back into my jeans. And then I started really working out. And then I remember my gynecologist telling me, it's good that you started working out early. All the hormones then are actually supporting you to get back into shape. So I want you to elaborate on that, please.
So, because you've touched this absolute sensitive topic of a C-section still in India, where as a obstetrician, where I practice delivering babies absolutely firsthand, I know that there's still a lot of myth and taboo attached to C-sections. That, oh my God, once you get a C-section, you become lazy and lethargic, and your body becomes exactly, and you can't go and or you can't hit the gym, or you can't do normal chores that you do after a vaginal birth. I'm telling you, sometimes if you land up in a complication with a vaginal birth, the episiotomy is going to be so big and it's going to be so dilapidating that you will be on the bed for 15 days. Whereas a good C section, you're going to be walking after 4 hours, literally, as soon as the spinal anesthesia goes away. So, not every C sections are very safe. Firstly, and not every vaginal birth is superior to C section. It's to patient. Having said that, we will call you after a week or 10 days. We're going to see if everything is fine. And then after 4 weeks, 4 weeks or 40 days is what we target as, where we let your body recuperate and rejuvenate. And if all's well, we tell the patient to go back to whatever was normal for you. Now, when patients ask me, can I weight lift during my pregnancy? Had you been weightlifting before? If you were, it's normal. So whatever your body is used to, because back in the day when there were no doctors, there were still babies. So they didn't know they were pregnant and they continued doing whatever they did. So
I was doing my plastic surgery residency, I remember.
Wow.
I remember Dr. Shekhar shouting at me, "You're pregnant. That's not a ball in your tummy. Careful, slow down." And this was like literally 2 days before my waters burst.
Right. So absolutely. So it's you're so right there, and it's not, as long as your doctor's given you a heads up and everything's good, you can go back. And if you are not feeling like there is some post-pregnancy blues that are happening, your body is taking longer, it's okay. That's also fine. We are not stereotyping here. We're not saying everybody is the same. Everybody is different, but nobody should stop you from doing it just because you went into an operative procedure, and nobody should say that you are anywhere handicapped. It's absolutely safe, and whenever your doctor gives you a thumbs up, go hit it.
And since she was talking to you about C-section, it is perfectly all right. I want to bring in one more thing. A lot of my patients are really worried about the C-section scar. Do you know now, for a good scar, we actually end up giving Botox in a normal situation, I'm saying. And why do we do that? Because Botox relaxes the muscles around the scar. So when the scar is pulled from both ends is when the scar is not healthier. It becomes darker. Chances of hypertrophy is more. Chances of keloidal tendency, if you did have, becomes more if there is a tension in the scar. But while you're pregnant, your stomach is expanded so much, the skin actually naturally doesn't have that kind of tension to pull it apart. So by the time your scar heals, your skin is slowly getting back to its normal. C-section scars are one of the most beautiful scars, isn't it?
I mean, you won't be able to tell also.
Exactly. You won't even mine. I can hardly see mine. So you don't even be. And I was thinking, wow, my gynecologist is so good. My scar is not even
We
seen.
like to take that
Exactly.
credit.
So here's the true thing about it. And the other thing that I want to address while we are talking pregnancy is pregnancy related skin issues. I'm not going into detail of rare issues and pathological issues, but simple issues that can happen to every pregnant woman, such as simply itchy skin. So it could be related to a few hormones, could be related to the liver, but that's in extreme situations. But in general, because the skin is spreading or opening up to accommodate your growing fetus, it's simply important to lubricate the skin. So I just tell them use coconut oil for all I care. Coconut oil, Pond's cold cream, any cream that you have, lubricate it in a way the skin can actually give in to the baby that is kind of growing inside. Can stretch marks be prevented? I don't think it can be prevented. If you genetically have, like I remember me and my neighbor got pregnant together and she had not a single stretch mark. And then I had loads of stretch marks. And then she said even her mother didn't have. So we know at that time I was just too new and too young. And then, yes, my genetically, my mom's skin was like that too. Her baby was one tiny baby she had premature. And
Right.
mine was Upasana Shetty, was full arm when she was born. So it's also depending on how much is it distending and how much it is breaking away. So these are a few things. You can put a lot of creams and lotions, just enough to lubricate at that point of time. A few addition of peptides might really slightly help you get it better. Post pregnancy, doing your little massages. And do you believe in tying that they used to wrap earlier? You don't believe, is it? Why don't you believe in that?
It also, see, sometimes what happens is they tie it up so tightly that it impacts the stitches that we've given. So even if they want to tie, especially in a C-section,
If it's a normal
so
labor, you end up.
then I leave it to them, to their discretion, that
Hmm.
if they want to do it, I'm very neutral to it. But for a C-section patient, not until the 40th day, till the time I'm sure that the sutures have healed and completely. Also, one thing that you rightly said about the moisturization for the stretch marks, I always tell them that you start it from the first trimester itself, before
Exactly.
the
When
skin
it
actually,
started expanding.
So
Yeah.
that obviously we can't prevent it, but maybe reduce it a tad bit.
So it's very, very safe to apply it right from the day one, and not only just to your tummy, your butt, your breasts, because all of these expand as well. So wherever things are expanding, just put a lot of lubrication. Like I said, any cream, any oil, anything is good enough. Also, post pregnancy,
Mhm.
what is the care a lady should take for the uterus to kind of get back to its original um, size, or rather tension in the tissue? How does it kind of get back? What about lifting? The baby itself is lifting weight, right? So is there a right position? How should they lift? What should they do?
So I think involution of the uterus, or the uterus basically going back to the pelvis, is the normal phenomenon which is going to happen in the next 40 days if everything goes well. What you have to do is good sleep, which is, I know, extremely difficult with a young baby. So capitalize whenever your baby is napping, you nap. Good diet, a rich diet in protein. With in India, we have so many myths about what can a pregnant, there's so many times the patient is going to come in and say, I've been told not to have anything that has spice or anything that is rich in protein, because the baby is going to get gut issues, the baby is going to get colic no matter what you do. That's the baby's job. So you have to keep your diet rich, because like you will be able to emphasize better that the hair is going to go through its now own phase, where postpartum hair fall is as it is going to happen. You have to pull up the iron game, because now your baby is taken all the iron that you took for the 9 months was basically you providing good nutrition to your baby. Now the next 3 months, or the fourth trimester that we like to call it, is for yourself. So you have to continue with your iron, calcium and protein supplementation, which 80% women stop, because they get so busy with their babies and they're like, okay, now the food is getting neglected, the sleep is getting neglected. That is not in our control. The sleep is going to suffer a bit, but what is in our control is taking those 2 3 medicines now. Don't stop that. Yeah.
So, as it is, the body goes through a lot of stress during pregnancy. Giving birth to a baby is stress for the body. You've lost blood, you've given birth to the baby, the nutrition has been majorly. Body has a beautiful way of concentrating on what it needs at that moment the best. At here, it is your baby. So everything is going to the baby. And then, like she rightly said, the minute pregnancy is done, you think that's pregnancy supplement, so I'm going to stop it. And because of the stress, also stress doesn't mean that today you're stressed and today hair is going to fall. It's going to take the toothache. You know, there's an old wives' myth or tale that they say, baby smiled and my hair started falling. You know,
Yes, I've heard of
you've
that
heard of
one.
that, right? So that is only to define that it takes 3 months for the baby to recognize, make eye contact, and smile. So when it 3 or whatever months, I don't know, I might be quoting it wrong. So it takes some amount of time. So that amount of time, your now body has processed the stress, and the hair, which was in a beautiful growing phase because it was supported by growth hormones. Your pregnancy hair, have you seen it? Feels lush and
Yes.
dark and beautiful and shining because all the hormones are also supporting it and the nutrition. Now, all that is suddenly all your growth hormones and supporting hormones towards growth is suddenly gone. And then your prolactin is increasing, which is also a slightly inflammatory hormone towards yourself. So your hair starts to fall, stress has made your hair fall, and your nutrition lack makes your hair fall. So please take specific supplements from then onwards. What I love giving for my patients, of course, is the raw anagen, which is our most bestseller. They love it and they start taking that. So that's something which is very nice. I also like to put them on defense to reduce the inflammation and maybe cut down oxidative stress also, because there's so much extra oxidative stress happening there. So this is what I end up giving. There are a couple of questions that I missed, which just came into my mind, and I thought they were very important, which I myself didn't know. What is PMDD?
So many of us suffer from it and we don't know about it. It's premenstrual dysmorphic disorder. Now
Not same as PMS.
it's 100 times of PMS. So let's just say, so what happens is, again, it's we've been stereotyped as women so much. Uska mood swing ho raha hai, pakka period aane wala hoga. Oh, she's just PMSing. That when somebody is actually struggling, you're going to just brush it off as, oh, she's just having a mood swing. She's just hormonal. Yes, she is. But tell me one thing, now that we are finally at a day and age when we talk about depression openly, when we know depression or anxiety, these are all chemical issues and not things in the mind. Uske dimag mein nahi hai. It's the serotonin, it's the dopamine that's playing the role. Just like that, just before your period, during, and even a couple of days after the period. So sometimes women feel extremely low even just after the period has gotten over. And then they go to the doctor, and most of them will be like, Arey, but now to you should be over with your PMS. But especially in the case of PMDD, these 10 days, say about 5-6 days just before your period, while you're on your period, and 2-3 days after your period, the sudden drop and fall in the hormones lead to changes in the other chemicals, which is the serotonin and the dopamine, and where you feel clinically depressed, you feel clinically anxious. So these are cyclical changes in the brain, just like how they are happening in your uterus, and they are beyond the woman's control. So just telling her, oh, you go and snuggle in bed or read a book or watch a movie, here it's not going to help, or eat a pastry. In a normal PMS case, all of this will help. We all do it every cycle. But in PMDD, you need a full holistic approach with a therapist, with a psychiatrist if needed, because if there are, if you need to give medicines, if you need to give the SSRIs, you need a gynecologist, because we're going to put you on certain hormones so that there are these fluctuations stop. Maybe make you
If they just simply go on oral contraceptives, they may stop.
no, because the oral contraceptives may sometimes further increase these symptoms. Because if depression is an underlying cause, estrogen makes the depression better temporarily. But we are also seizing the estrogen spike in a birth control pill. So then there's going to be no good phase only that will come. And the plateau is not good for these patients. So sometimes, in fact, OC pills can trigger underlying depression. And that's why then the patient will come and be like, ma'am, you told me I'm going to feel better with these mood swings, but I'm feeling worse. I've lost the libido completely. I'm having massive mood swings. That's because there was something underlying which was missed. And that's why we as doctors now also have to be very receptive. And sometimes mothers will come in and they'll be like, she throws things just before her period. She gets so angry she can't talk to me. Those are telltale signs. Sometimes one session in therapy, and even I as a gynecologist, I've learned so much about PMDD after I actually started seeing these patients, because they would all be stereotyped as, Are PMS hai, Are teenage hai. And like you said, just how the teenagers are going to come sooner to you if they have acne. The sooner they are going to go if they need therapy or if they need counseling or if they need to control those mood disorders, the easier it is going to be for us to handle it.
Yeah. Also, I want to just touch upon this because I've seen a lot of rise of case of endometriosis. Can you just tell us briefly what it is and what hormonal swings does that throw up?
So endometriosis in layman language is nothing but when your period, whenever you go in your period, the menstrual blood that comes out, some of it also goes and accumulates elsewhere other than the endometrium. And that's why the word endometriosis. The commonest being the tube and the ovary. So the chocolate cyst or the endometrioma is one of the most common thing that comes to the ovary, and then the tubes. What happens is, number one is going to give you extremely painful periods. Extremely painful. And typically the patient will say, I get pain 2-3 days before my actual period shows up. That is congestive dysmenorrhea is what we call it, not spasmodic. Spasmodic is what we all have normally. And then she will say it gets relieved after the period starts or 2-3 days later. If it's severe, they're going to have problems in going to pee or even poo. It gets that bad because it can reach your bladder or your rectum. And eventually, it's going to, even very, very early endometriosis can lead to infertility. Because, like I said, it's affecting the ovaries, so it's going to affect your egg quality. And it's affecting your tube, so it's going to have a problem with the egg reaching the and egg and the sperm meeting. Why is endometriosis increasing? Same reasons why other lifestyle things like PCOS are increasing. Also, awareness and tools to diagnose endometriosis have increased. Right. So we've been started diagnosing it also. And of course, it's on the rise, but it's common, it's treatable. And the sooner you treat it, the easier it's going to be.
What's your take on this app? Everybody's on a fertility app.
Hmm.
How much does it kind of really sink in and how accurate is it?
So I don't believe in those apps, and I'm going to be probably called out for it.
Yeah.
But because it's a very simple math that you can do, when you get your period, subtract 14 from it. 14 days from the day you got your first day of your period is the day you ovulated. Now, when you want to know your fertile window, you're going to take an aggregate of those 3 months. So supposing today I got my period in 28 days, and the next time 32 days, and 30 days. Take out a mean of it. 4 days before it, 4 days after it is your fertile window, which for 70% of the people is going to come to 11 to 19 days. However, if your cycle is longer, it's going to be different. And here's where the apps fail, because they are only going to be telling you that standard 30 days wali cycle mein 11 to 19 days is your fertile window. And then sometimes your cycle is 40 days and you're trying in that period and you don't get pregnant, or when you don't want to get pregnant and you have unprotected sex in the 24th day and you get pregnant and then you come, but my app told me that I was not fertile. So it's okay to remember your period, but don't be too dependent on it. Here is your app and it's enough.
Yeah, I think we never had an app.
Yeah.
I remembered it here only.
Exactly.
Yeah. So I also want to know one more thing. So many times I get asked this question, that is there anything that you can do to improve or decrease your fertility? For example, in lifestyle, not necessarily medicines. I'm saying in lifestyle, or is there something that you eat?
One thing that we all have to understand is, and maybe I don't sound cool at all when I say this, is any form of smoking is going to be horrible for your fertility and everything else. Your super cool e-cigarettes, vapes, marijuana, anything on this planet, you call it herb, you call it jadi booty, you label it whatever you want to. If it has smoke, it's going to be extremely bad. Your shishas, hookahs, all these things are going to be terrible for your fertility. So even recreationally, stay away from this one thing. Absolutely, that is where I am going to be very strict. This is a no-no. Rest. I know we are in a generation, a time where we all want to socialize. The weekends are a fun time. Enjoy yourself, but also understand your body is aging every day. I'm not as young as I was yesterday and not as old as I am tomorrow. So just take care of yourself, wherein sleep. Try to get that 6 to 8 hours of sleep.
Yeah.
It's so important. The hustle culture has become so cool. Oh, I just sleep on 3 hours. So and so said he became successful because he just
slept for
sleeps
4 hours. Yeah.
No,
Yeah.
that's not going to lead to a healthy life. That so and so also maybe later on is going to suffer from a heart condition, is going to have a lot of things. We don't know where the fertility is. For normal human beings who need to function to day, the common man, please get to those 6 to 8 hours of sleep. Eat healthy. I'm not an advocate of fad diets, extreme, weight reduction or anything. Slow and steady wins the race. If your doctors advise weight loss, it's probably for your best. If you think you're extremely underweight, that is also a problem.
What is this? You're saying weight loss for everything. How uncool. 1 star you're getting.
Yes, 1 star. And I'm also saying that sometimes we tell you to gain weight. That also is taken negatively. But anything extreme is bad. And stay away from the common thing known as junk food, because most of the junk that we consume is going to have everything that's going to impact your fertility and your hormones. So keep that one Sunday binge, but rest of the day eat healthy, sleep healthy, and we use it so commonly. I fail to follow it so many times. Keep your stress as low as you can. We all have stress, but we have to learn to manage it.
I think it's same as what I keep telling people for the skin. I say if you feel like indulging in a little bit of alcohol once in a while, go ahead and do it. But even one cigarette once in a while can really be detrimental to your skin. It kind of causes vasoconstriction, causes a graying kind of pigmentation on the skin. It's nothing but a burst of free radical damage and inflammation. So it's why would you do that? Yeah. So the other thing I want to also ask, now that you're talking about all of these habits, most of them live in it, but at the same time, they're all scared. Oh, my fertility period is running out. What is this scare of what is the right period? And everybody's freezing the egg. Everybody is worried about biological clock ticking.
So one thing that you can't fight is your biological clock. Men are lucky that way, that every 3 months there's spermatogenesis. So basically they get a new cohort of young sperms and they forever or for the longest time remain fertile. However, with women, like we said earlier, are born with a certain number of eggs from day one. And that's the number of eggs they're going to have. They're only going to reduce with every period that they get, and so on and so forth. Yes, you don't have to panic if you're in your 30s, if you're in your late 20s, late 30s, you're not ready for a child, you're not ready for a child. It's a career taking ahead of you, whatever, you have your own personal choice. But take charge of your fertility. Don't let fertility take charge of you. So in your mid 20s, late 20s, if you've decided, I'm going to take my own sweet time, I want to first see where my career is going, just how you save your money in an FD or a bank, or invest in equity or whatever you invest your eggs in the IVF bank.
Egg storing bank.
Yes, so just give. And why do I say as young as when I started my fertility journey, we used to be scared to tell the girls in their late 20s that now is the right time. So we used to tell the women in the 30s. But with the low AMH, we are going to pump you in. We have to put more gonadotropins, more injections to get the cohort of eggs we need. And still maybe we don't get as many as we would have when you were in your late 20s or mid 20s, because it's the age that's taken over and so many eggs have already died. However, having said that, if you're in your 30s and still not decided, it's never too late to freeze your eggs. Even if you are so much, so the one lady who I've frozen eggs for, she's 36, and I asked her, I said, now? And she said, yes, 39. Then there was another one at 39 with a very low AMH. We did repeated cycles and we got 10 oocytes finally.
Wow.
And now fine, she's, whatever age she decides, whenever, till it is safe for her biologic.
How many has India, or have you, not you, I would say has general population, have they thawed and really got a baby out of the egg?
Oh, very common. So
It's
now,
become very common
the
now.
thing is, I always say embryos are the fighters. They're the strongest ones, but eggs are very strong as well. So freeze your eggs. We try to freeze in more because yes, if we freeze 20, maybe we are actually going to make 10 or 12 babies out of it eventually when they're thawed and when the sperms are injected. So that's the reason why the earlier you do it, the better it is.
And healthy babies and absolutely
healthy babies,
perfect.
absolutely perfect, and nothing, no genetic disorders, nothing. And you're going to be thankful later on, because like we know, there are, other than the fact that it's going to reduce your fertility, it's going to, the older eggs are going to increase the chances of things like Down syndrome, which these younger eggs won't have. So even if you're 40 but your egg was 28 or 29 when you froze it, your baby is not going to get the 40-year-old wala old egg.
Exactly.
That's what we need to understand.
And I keep also discussing with my patients that talk to me and talk to the gynecologist together, because at the same time also the skin starts to get impacted, because there's a lot of hormones that's injected into you that may wash off in some time. So don't panic. It's okay. Once the hormones are kind of washed off, this whatever has happened to the skin will go. But in the meanwhile, while there is wild acne for some people that might happen, it's better that you get treated by a dermatologist. Don't self-medicate at that time, because you're actually prepping your body to get the best eggs out. So ask your dermatologist, treat the acne so the marks become very difficult. Acne will anyway go after the hormone cycle is done. So PMS is such a big issue with all the young girls, right? So we did speak about the extreme, which you called as I keep
MDD.
forgetting, PMDD.
Right.
And PMS itself is something that all of us have faced.
Yes.
There are sometimes just a few right supplements can also give a lot of relief.
Yes.
What are your favorite ingredients while you're choosing a supplement for PMS?
Right. So we all, recently there was a whole hue and cry about meftelspas and whether mefenamic acid is safe or not. So that is one of the common things which we give when already the cramps have started and when you're in pain. But a lot of adults are going to have this problem. We don't want to take a painkiller. So there are then other supplements that you can take to at least subside it or reduce it a little bit. Ease yourself through PMS. So if there's enough research wherein especially the micro elements like zinc, magnesium, a lot of vitamin B complexes are going to, when taken in the right amounts, help you. I'm not saying they're going to completely avoid the cramp altogether, but it's going to sort of hold your hand and tug you along that PMS phase.
Yeah, so adding a few more herbs, we've also seen that it really takes away the premenstrual flare up of acne. So we have something called as a PMS relief, which has really given us a beautiful, like over 5 years, we have case studies which have shown us that it really helps the premenstrual acne flare ups along with PMS. The other ingredient that I find very interesting, and I see a lot of my gynecology friends' favorite ingredient is primrose oil. Do you like that too? And why do you like it?
Yes, because so mastalgia or breast pain, what we talk about, is going to happen to you maybe when you're ovulating or during on your period. You're going to patients come in and they're like, we're feeling very heavy in the breast. There's tenderness. I can't even touch it. And primrose oil with vitamin E. This is a combination that I love, and you have to take it for a period of time, like at least 3 months, and it's really, really, really benefits you.
Yeah. So any supplement for that matter, it's not a pill, it's not a painkiller, it's not a magic. So you need to, that's why it's a supplement and not a drug. You need 2 to 3 months for it to actually come to what it has to bring you on the table. Now we are on to our fun section. Let's do myth or facts.
Ooh, I'm excited.
Tiny little explanation on each one of them.
All right, let's go.
This is a quick round.
Done.
So women's period synchronizes when they spend a lot of time together.
Absolutely not true. It's a myth.
Okay, yeah, I'll finish all my and then you'll go. Okay.
Fair.
Tampons can get lost during your period, especially.
So it's a closed canal. It's just a one-way entry. Nothing is getting lost. Above it is sitting your uterus and the cervix. So wherever it goes, your vagina is only this much. We'll get it out. Nothing is getting lost.
She's going to get it out. Don't worry. Periods are the body's way of removing toxin.
Not at all true. That's the reason we used to be put out and not kept in houses because they thought it's some dirt or some toxin
Gudna, they
coming
thought
out.
like that. I think those days, women who really worked all day long
Yeah,
serving
they
all the men, they got that 5 days of rest where they were actually served.
But also the sad part was they won't get proper toilets because of that.
Oh, really?
Yeah. So in the villages, they would be put out and they won't get a clean toilet because the only toilet was being used by the men.
Oh, that's sad. I never thought of that. Infertility is only an issue after 35,
Not true at all.
especially now.
Yes.
Age does not impact male fertility.
That's also not true.
Maybe also.
Maybe
maybe
not as
not.
much
Uh-huh.
because it depends if with age are you getting other diseases, other comorbidities. If nothing, then to 80 also they're young.
You should not work out during your period.
Not at all. If listen to your body. If your body is saying yes, go ahead and work out.
Yeah, probably just because you're losing blood, your hormones are low. In fact, I think if your body is not that tired, you should be working out to get your good hormones up.
Yes, because then you'll feel
Happy
happy.
hormones.
Yes, absolutely.
You can't get pregnant while you're on your period.
So 99% you won't, but also 1% chance you can. More chances you're going to get a sexually transmitted infection. So please use that barrier protection.
So fertility issues are always a woman's problem.
Not at all. Not at all. Please, biggest myth.
Yeah. Certain foods can delay or prepone a period.
Not at all, because even the most common one that we want to talk about right now, the papaya, you'll have to eat 40 or 50 papayas to get your period, still you won't get it. Sometimes they'll have unprotected sex and they'll have papaya for 15 days. By then they are 6 weeks pregnant, then they come to me, but I ate papaya, nothing happened. I didn't abort. So no.
So you eat papaya, you get aborted?
It is the myth.
Ouch.
So no.
Yeah, it's like people saying, I don't want to take vitamin C supplement. I eat kiwi. How many kilos?
Exactly.
Okay. Yeah. A woman's weight affects her fertility.
Yes, it does. Whether underweight or overweight, both will affect your fertility.
You're done, baby. 100 on 100.
Yay! All right, but you,
Okay.
because the producer has told me
Huh.
that we can't let you go so easily, so
Uh-huh.
now it's my turn to ask you, and I'm
You
so
know, the
excited.
only person I'm scared of in my whole life
So imagine
is
now the
my
questions
daughter.
are coming from there.
Ouch.
Okay.
Huh.
Hormonal birth control always clears up acne.
No, not really.
Absolutely.
It's not just birth control that's given in hormonal acne. You could be hyperandrogenic. You may need something else. Your prolactin could be high. You may need something else.
Right.
Thyroid can also lead to it. So no, that's not a
And
blanket.
the lifestyle that they
Exactly.
have.
Not a blanket.
Yes.
Not at all.
Okay. Hormones only impact women's skin and hair.
No. Why? Excuse me.
The poor men who are coming with
Yeah.
Okay.
Yeah.
All hormonal acne is same.
No, not really. Like I said in the first question, there are multiple hormones which lead to acne. That's where the expert comes in to diagnose through clinical signs and some blood investigations which one and treat accordingly.
Right. You can't get facials during pregnancy.
Why?
Thank you.
Yeah, I'd like more.
Exactly.
Yeah, add to the pregnancy glow, like the relaxation.
Yes, and the
happen.
pampering.
Yeah. Yeah.
Okay. Hormonal changes lead to permanent skin conditions.
Not really. We can fix every hormonal change.
Melasma post-pregnancy disappears on its own.
Melasma post-pregnancy for a long time used to be called as cloasma because they
Yes.
thought this is going to just disappear. Sometimes it does, sometimes it doesn't.
Acne is the only skin concern related to hormones.
No. Pigmentation, skin texture change, acanthosis, which is because of your insulin. That's again other hormone that can go wrong. Hair fall, hajar things.
Yes.
Huh.
Okay. You should use the same brand for all your skincare products.
Why?
Exactly.
No. Use whatever you like. But I'm highly against using 85 things on the skin.
Right.
I was just telling a patient today, she came from another clinic with a prescription. So I'm looking at it and I'm saying, oh my God, this many things, how do you put? Then the best part is she's turning the page and she's saying, that was AM routine. I'm like, yeah.
The Korean skincare regime
And
is
you will
going on
become Korean?
12-15.
Not happening. Yeah, my point on an Indian with this kind of climate and this kind of pores that we have, and actually a healthy, oily skin that we have, we're just caking the skin up, clogging it, and not allowing anything to work. You're putting 10 things together. I always believe in saying one hero ingredient towards what is your skin issue, and one supporting actress to just support the whole thing and make it 2 things at a time max. Chalo. If you love skincare, 3 things.
3 things.
But not more than that at one time. Yeah.
Absolutely.
I'm done.
So that's
How did I perform?
100 on 10, I think. And you don't realize what is going to happen after this podcast is I'm going to come as a patient as soon as I go.
I wish
and
I could
stay.
say I could come at this stage for fertility.
Absolutely. Now you're a fan after this podcast.
You know, when she came in, I had already worked half a day. I'd done my workout in the morning. I had finished one more podcast with an expert who had flown from another city. And then when she walked in, I said, I'm so tired. I don't know how I'm going to be. This conversation became so much fun and
It was very
energetic.
organic.
I loved it. I can go on for another hour, but we need to call it a break. And we shall talk about more issues in the next probably subsequent series that we're going to bring in about menopause, hormone replacement therapies, and so on and so forth. There's so much more to do. Thank you so much.
Thank
it
you
was so much fun, and thanks for bringing in this energy.
Thank you so much for giving a young person an opportunity wherein I know there are all, massive names coming in here. So thank you so much. Thank you for having me over.